Hello, everybody. This is Professor Jing. Today, we're going to talk about qualitative analysis. This is a very important topic, so let's waste no time and dive in. I will start today's lecture with some brief introduction of the qualitative analysis and why it is important in the healthcare space. And also, we will talk about some of the key qualitative methods, including interviews, focus groups, observational studies, and document analysis. So, what is qualitative analysis? In simple terms, it is a way of understanding people's thoughts, feelings, and experiences. Unlike quantitative analysis, which dealing with number and statistics, qualitative analysis focus on words and meanings. So in healthcare, this approach is incredibly valuable. By listening to patients and healthcare workers, we can gain deep insight into their experiences and needs. This helps us to improve patients' care, develop better policy, and continuously enhance the quality of healthcare services. So, why qualitative analysis is important in the healthcare space? First, let's talk about the patient-centered care. It is about understanding patients' personal experience and feeling about their treatment. By listening to what patients says about their hospital stay, for example, we can learn what makes them feel comfortable or stressed. This can help us to improve their overall experience. Next, we have policy development. So the policymakers uses qualitative data to create better health policies. By interviewing patients and healthcare workers, we can gather insights on what change are needed in the healthcare law or regulations to make them more effective. Let's discuss quality improvement. Healthcare services rely on feedback from patients and staff to get things better. Qualitative analysis help us to identify areas for improvement that number alone might not show. For instance, a focus group with a nurse might review issues with hospital equipment that, when fixed, can enhance patient care and safety. So we're going to talk about a few key qualitative methods. So we start with interviews. Those are the one-on-one conversation where we ask patients or Medicare providers open-ended questions to understand their experiences in details. For example, we might interview patients about their experiences with a new treatment to get deeper and personal insights. Next, we use focus groups. So this involves with guided discussion with a small group of people who share common experiences or characteristics. By facilitating a group discussion, we can gather a range of perspectives. For instance, we might bring together a group of nurses to talk about patient safety protocols. Another important method is observational studies or observations. Um, Here we watch records behaviors or interactions in a natural setting without interfering. This helps us to see how people actually behave in the real situation. For example, observational interaction between doctors and nurses during patients around can highlight areas for improving teamwork, right? And lastly, the document analysis. This analysis really involves with examining the existing documents like patients' records or policy reports to gather data. It helps us to understand the context and background of the issues we study. For instance, reviewing patients' feedback forms can reveal common themes about hospital services. So they are really helpful. So what is the definition of an interview? It is basically a conversation between two people, or one person, the interviewer, is asking questions, and the other interviewee provide answers. This is very useful, and it helps the interviewers to get deep dive into a specific topic and through surveys, they might miss some of the areas or certain topics. The interviews between the two people can definitely help the interviewer to get that information. Talking about the interview steps, there's a few steps that is important. One is preparation. For the preparation, we basically prepare by setting clear goals for what we want to find out and crafting open-ended question that encourage detailed response, right? So for example, instead of asking, did you like your treatment? We might want to ask, can you describe your experience with the treatment? This sort of approach helps us to get more insightful answers, right? The second step is conducting interview. So during the interview, it is important to build a comfortable environment, listen carefully, and ask follow-up questions based on what person shares. This way, we can explore topics more in depth, right? And the next step is after the interview. So after the interview, we record and review the responses to identify common themes or issues. This helps us to gather valuable insight that can improve patients' care, policy making, and overall healthcare quality. So the next method we're going to talk about is focus group. So a focus group is a small, carefully selected group of people who discuss a specific topic together. In healthcare, this could mean talking with patients, doctors, or nurses about their experiences, or could be their opinions. Here's how it works. First, we choose participants who have relevant experience. For example, if we want to understand patient satisfaction, we might gather patients who have recently been treated. Next, we prepare open-ended questions that encourage detailed discussion. During the focus group, a facilitator guided the conversation, ensuring that everyone has a chance to speak and that the discussion stays on track. We might record the session with permission, of course, to capture all the insights. Um, by listening to the group's thoughts and experiences, we can gain deeper understanding and identify areas for improvement. For example, a hospital might use a focus group to find out what patients liked or disliked about their care, helping them to enhance their services. So next we're going to talk about observational studies. So observational studies involve watching and recording what happens naturally without interfering. In the healthcare space, it means observing how patients and healthcare professionals interact in a real life setting. Here is how it works. First, we decide what you want to learn, like how patients interact with staff in a waiting room. Then you choose where and how you observe either openly or discreetly. During the observation, you take detailed notes on what you see and what you hear. Make sure respect people's privacy. For example, you may want to observe a hospital ward and understand how communication between doctors and nurses impact patients' care. You look at the pattern, like how often patients ask questions and how quickly staff respond to needs. The last method we're going to talk about is document analysis. By definition, document analysis is used to review the existing document and records. So basically, this method is very useful. Especially, it allows the researchers to perform a deep dive into the data and be able to identify and examine the pattern and themes. So there's a few common techniques that we use in this analysis. So first is coding. So coding is like organizing a big pile of information into smaller, manageable chunks. We label those chunks with code based on what they are about. For instance, in several patients talk about pain relief. So we group out those mentioned under pain relief code, right? So next we're going to talk about thematic analysis is to find the pattern or the themes in the data. This helps us to understand what topic come up the most, right? For example, in many patients, we probably they talk about communication issues, and we recognize this as a significant theme that affect their experiences, right? So we also use content analysis to count and analyze specific word or phrases. This will qualitative find our data to help the spot trainings. If the patient frequently mention about waiting time, and we know it is an important issue to address. And finally, we often present our findings visually with chart or word clouds. This will make easier to see and understand the key points. For example, the tool that is commonly used is a called word cloud that may show waiting time or pain relief as a common concern. And we can use that to intervene, right? So it is very important to the healthcare or even healthcare insurance company. They often will use those kind of visualization to show the meanings or the findings. When you choose to use certain method for your quantitative analysis, you have to think about limitations. So there's no such a method that is perfect. So that's why you have to know the limitations and when you use them. So for example, for interviews, right, the limitation is could be time consuming, right? So if you have a large number of participants, then you will try to interview them one by one. It takes time, right? So, as for focus group, when you talk to a group of people, and one individual can be influenced by the large group. So, that could be a limitation for your study. And even observational studies, you might see that observer present might alter the behavior, and it can be subjective. And even for document analysis, right? You look at documents, you probably find out, they're incomplete or out of date. So, even when people interpret the data, it can be subjective. People may have different interpretations. So you have to keep those in mind, right, for the limitations. And when you try to do your analysis, you should choose the best one that works for your for your studies, right? So just want to point out those limitations and thank you so much. And we will do some analysis, some exercise in qualitative analysis. So make sure that you read the slide and understand the concept. Thank you.